about having workspaces that are somewhat separated. So we want to go from this type of workspace, if this is what you have in your organization, this would not be good social distancing. We want to go to something that's more perhaps like this. Okay, so those are higher level strategies that can be done, including engineering controls in a higher severity type of flu environment. Okay, so let's go back and see how you guys did on our quiz. I don't know, Ira, do you have the poll results from our little quiz?
Yes, I do. Here we go. And we were perfect.
We were perfect. Everybody picked D? Good. Okay, I guess that wasn't too difficult. Yeah, obviously we don't want to have a bunch of sick people working together. We want to send them home. Okay, so now let's talk about what can we do with our business operations in our pandemic planning. Will there be an increase or decrease in demand for your products, and how do we plan for that? Well, you want to determine what your essential business functions are. First of all, in terms of your personnel, you want to make a list of all of your essential personnel and have alternatives. Basically, you put this on a spreadsheet, all of the personnel in each department, list who they are, and list who the alternative for that person would be in their absence, so that you have continuity. And of course, this may require some cross-training. You have to do the same thing for your suppliers. For your suppliers of your raw materials or other vendors that you rely on. You might have. In fact, let's go over here. I should have done this before. Again, another little true-false here that hopefully Ira can still throw up. Your company will recover quickly from a flu pandemic as long as good business continuity plan is in place. That's what we're talking about now. True or false? Your company will recover quickly from a flu pandemic as long as good business continuity plan is in place.
And we have the votes coming in. We'll just wait another 15, 20 seconds or so. Okay, looks like we've all answered.
Okay, so we'll get to that in a moment. So basically you want to have, even for all your suppliers and vendors, if possible, you may not have much control over what they're doing for their pandemic plan to keep their business going, but your plan might be that perhaps you can find alternatives for those products ahead of time before you need them. Same with any subcontractors or temp agencies that you use. If you rely on temps, perhaps you'll have a second or a third agency available just in case their people are sick. And then once you've developed these spreadsheets with all the folks and you've got them all cross-trained, you obviously want to have a way to get a hold of everybody. So phone numbers, alternate phone numbers, wife, husband phone numbers, emails. If you have a company intranet that you can post these absences on, and how are people going to know, have a strategy to communicate with people when they're needed to fill in as an alternate for an essential business function. And the same with your suppliers and subcontractors. Okay, so how was our answer, Ira?
Let's see here.
Your company will recover quickly from a flu pandemic as long as a good business continuity plan is in place. Are you showing the results?
Yep.
Everybody said.
So yeah, we had most people said true, a couple said false.
Okay, well, it's actually false because you can have the very best business continuity plan, but it doesn't guarantee that your company will immediately recover from a flu pandemic. You depend on these other folks sometimes, these subcontractors and suppliers, and you don't have control over those things, but you can try to prepare for disturbances in those functions. So you want to just prepare. Okay, so we've talked about business operations. How do we involve our employees in the planning process? Well, we talked about education and training. Again, posters, tutorials, online tutorials, written materials are very available and can make people have a good appreciation of what you're trying to do. You need to answer their questions about different aspects of the program. What if their typical public transportation isn't available? What's your policy? What do they do? Review the prevention measures that your company is taking to help them. If you have a flu shot program, obviously that's something that you will be you either have or will be promoting. Personal hygiene, we've talked about covering your cough, wash your hands, wash your hands, wash your hands is the most important. Are you providing personal protective equipment in terms of face masks and or respirators? Explain to folks, how they get a hold of those, when do they use them? Will you have hand sanitizer and tissues located throughout the facility? Make sure they know about those things and that they're using them. We talked about the social distancing techniques that may go into effect. You need to have the communication so they understand why this is happening. Review the sick policies. Some of these might be different in your pandemic plan than your typical sick policies. So, in the context of the pandemic, what if a family member is sick? Perhaps you don't ordinarily let them take off work if a family member is sick, but maybe in your pandemic policy you will. Is that something new for them? What symptoms will they be sent home for? Will they be sent home if you go into a higher level severity? Is that when they'll be sent home? That needs to be communicated to them. When can they return? Talked about whether or not they need a doctor's note. And will they get paid? Is there any difference in your sick leave benefits because of pandemic planning versus their typical sick leave policies? So they need to understand what's different about the policies you're putting in place during the pandemic season, and at what point those policies might be withdrawn, or that you revert back to your typical sick leave policies. And the bottom line here is that employees who do feel safe and that the company is looking out for them are less likely to be absent, particularly if we can prevent the spread of a lot of these illnesses in the workplace. Okay, so that's about developing our plan. Now, some of these things you can do yourself. Some of these things you might want to rely on a medical provider to help you with. Some of the things that we do at IMCC for some of our clients are to assist in developing the actual written plan. This is just one of the templates that we use that covers a lot of the things that we've talked about today. Flu clinics, of course, now the season of flu vaccine is going to be supply dependent. If you've not done that program yet and you still want to, we will just have to wait and see if we are able to get more seasonal flu vaccine. We are expecting some more, but it's just not clear exactly when and how much that we'll get. So if you've not done a program you want to, please let us know, and we will do the best of our ability to get that. The H1N1 vaccine, we have already run through our first allotment of the flu mist, which was for younger, healthier people. The injectable hopefully will be available shortly. We've all heard about the delays in the production of the vaccine, and this virus, any flu virus takes generally 6 to 9 months to grow, to produce a vaccine. This is, they're grown in chicken eggs. It's an old technology versus some of the bioengineering that is done but not yet FDA approved, which is faster. But most of the manufacturers use the old technology of growing the virus in chicken eggs to produce the vaccine. And the H1N1 virus has not been as prolific as the seasonal flu vaccine. That's why there's been delays.